We need drugs. Of course, we need surgeries, but we also need the power of the mind. Now we have the evidence-based proof that the mind can heal, and it should be added appropriately to drugs and surgeries.
I've spent my whole life professionally documenting what a powerful difference these simple changes can make. You know, we think it has to be a new laser, something really high-tech and expensive, a new drug, a new surgical technique. We are trying to show that these very simple choices that we make in our lives each day have a powerful impact on our lives, much more and much more quickly than we had once realized, for better and for worse.
Absolutely, we have much more to say over how healthy we'll be than our doctors. And how we do that, whether it's through yoga, whether it's through meditation, whether it's through exercise, whether it's through changing our diets, whether it's through giving more airtime to our relationships and appreciating that our relationships aren't like off to the side someplace. They're absolutely critical to how well we will feel.
I believe in the power of group support. I have no doubt at all that it helps people live better. And we are not just splendid individuals. We define ourselves in part by the people around us and how they interact with us. And so I have no doubt at all that it helps people live better. And I think the evidence is accumulating that it helps them live longer as well.
I know our mind and body are connected. I've had thousands of patients get pregnant. I know there's a mind-body connection. I've seen it, I've done research on it. It's a given.
I think mind-body medicine is central to good medicine. In fact, you know, one thing I often say is that one day we'll be able to drop the word integrative. This will just be good medicine.
There is no doubt that the mind and the body are connected. There is no doubt that the brain and the immune system and the rest of the body are connected. And that when those connections are intact and in balance, you have health, and when they're broken, you have disease. You can't always overcome your genes. You can't always overcome your environment. But with help, with an experienced practitioner who can help guide you, you can find the best formula to help your body and your brain to help you heal.
And what I'm about to present to you tonight is, I think, an application for us as healthcare providers, and how mindfulness can be a part of our lives in kind of the role that I see it in. I have my disclosure slide. This says nothing to do with industry at all, but I will share with you that I am a previously burned out physician who completed mindfulness-based stress reduction. I look within myself, and I'm a daily practitioner. But nothing to industry here. So this is what, the first thing is we all need a mirror. Be able to pull that mirror up and be able to look at ourselves for who we really are at that point. Not necessarily who we believe we are, but who we really are at different points, and decide where to go from there. So I share my little story here. You know, probably started about 3 years ago. Getting on a plane to go to San Diego for vacation, and you know, I was pretty spent at that point. I completed medical school residency, cardiology fellowship, 5 years of practice, and I was really looking at that point to escape the treadmill of medicine for a while. I'd forgotten the human being within myself that started this journey to be a healer. Who am I, and who had I become? The answers were not what I wanted them to be. How did I get here? I was a go-getter, an overachiever, and I was supposed to be able to fix problems, including my own. I'd grown disconnected with my family as the job was consuming me. I cared deeply for my patients, but I was not taking care of myself. I was supposed to be indestructible, at least that's how I was trained. I could stay up on call for days, skip sleep and meals, and deal with sick and dying patients. I was also my toughest critic, and it was destroying me. I just needed to get on that plane with my family and temporarily stop being lost at sea with the waves crashing over me. And how many people out there feel like, at different points of their life that how am I going to keep going doing what I'm doing? Anybody? How many people have felt that way? And how many people are still searching for those tools to try to be able to find more balance to achieve that goal? So this is my wave that crashed over me. And it's an interesting little story. So we were on vacation, and I happened to be at a little cafe, and we were having breakfast with my family. And this painting was actually on the wall. And interestingly, my wife said, "Wow, that's really neat painting." And the owner of the little cafe overheard us and said, "Oh, wow, that's great. You really like that. I'd like you to meet the artist. He lives down the street." So he said, "Oh, that'd be fantastic." So this man here, John Pierre Marx, shows up in his car and basically takes out his whole gallery essentially and puts it out. He puts it outside of this little cafe, and he had so many wonderfully vibrant art, and we ended up bringing a little bit home, and he happened to throw me a book that basically said the title of the book is "Wake Up to Life," and he said, "Oh, by the way, on the side I do behavioral and spiritual therapy. I run a yoga and then meditation center in Coronado." And that's where I got to know him. And this picture on the left there is actually when he came here last year, and he did a Healthy Mind, Healthy Body conference, which was the first conference for the New Vector Wellness Initiative. And I think that one of the things that we're all looking for is exactly his quote here: "A human being cannot be divided into parts. The whole must be considered in order to find the balance in physical, mental, and spiritual health." And it's true, we're looking for balance. We're all looking for balance. And that's not always hard when different things in different points in our life are coming at us. So I think that to start out with, we have to really understand and define what burnout is. I think that most of us, have used the phrase, "Boy, I'm really burnt out. I'm feeling like I'm just burnt out." So they have to kind of break it down a little bit so we can at least say what the points are. So burnout's been defined as emotional exhaustion, depersonalization or cynicism, and a reduced sense of accomplishment. And it's usually by this Malish burnout scale, which I think is this big, long list of things, about 22 different items that usually is what burnout is measured by. And then let's take a look in terms of burnout in healthcare. It has negative effects on the quality of care. So how well we take care of the patients that we care about has to do with how we're able to come to the table. It has very negative effects on our own well-being. And we continue to see more and more about physicians that struggle with addiction, with divorce, suicide, and self-care. And you can take physician and you can change it to any other part, really, of healthcare, whether it's nursing, other professionals, people that work in mental health. And let's not forget, when we're not in the place where we need to be, guess what? There's a path of destruction that goes on around us. It would become difficult to deal with, difficult to work with. So what percentages, and this was from Medscape, a survey this year. It's very humbling that just about and actually when you take all of them averaged together, 46% of physicians are burnt out. And at the top of the list is critical care, ER, family practice, and internal medicine. 50%, 1 in 2 doctors are burnt out, meaning that they have one of those symptoms of burnout: emotional exhaustion, depersonalization, or a lack of sense of accomplishment. And so what are the causes? We all are in this new world of medicine and healthcare, and we don't know where it's going. So there's a certain amount of uncertainty that we're all experiencing. There's a certain amount of fear, because everything is evolving and things aren't under our control. But the causes of burnout, this included bureaucratic tasks, too many hours at work, income, the computerization of healthcare, Affordable Care Act, difficult patients, feeling like a cog in the wheel, too many patient appointments in a day, inability to provide quality care that they need, lack of professional fulfillment, difficult colleagues, difficulties keeping up with the current standards and guidelines, compassion fatigue, difficult employer. And so one would go, okay, well, many professions are burnt out, but we really are just about 16, in terms of physicians, 16% higher than the average U.S. worker. 46% in this study in 2002 had one symptom of burnout, 37% screened positive for depression, 6% with suicidal ideation, and 37% were dissatisfied with work-life balance. Sandeep Johar has written a wonderful book called Doctor, The Disillusionment of an American Physician, and he actually, he's a cardiologist that practices at Long Island Jewish Hospital. In this book, actually, he really laid raw his own experiences as a cardiologist early in his career. And really, he speaks to a couple of things of the downsides. Perhaps the most serious downside is that unhappy doctors make for unhappy patients. And the practice of medicine today almost seems to promote burnout. Doctors are working harder and harder, and many continue to demand perfection of themselves. So when you look at it, we're set up, right? We're set up in healthcare for trying to deal with burnout. And, again, we're our own worst critics. Nurses don't fare much better. So this is a study from just a few years ago that looked at nursing burnout. And nurses, floor nurses in the hospital that are direct patient care, about 35% burnout. In nursing homes is about a little bit higher than that, probably about 38%. So the bar's not much better. So again, if you take the word physician and you change it, like I said at the beginning, with nurses, whoever, we have our challenges. And so one of the things that I always try to talk about is that this is not about negativity. This is about accepting where we are and deciding that we need to overcome our challenges. So, this is not bashing. This is putting the mirror there and going, okay, where are we? Who are we? And where are we going to go from here? So if we look at root causes, why are we at the point? Why do we have 1 and 2 doctors are burnt out? What is the problem? And I listed some of those other things there in terms of what some of the reasons were in that Medscape study. But let's face it, it's our training, our system, our own personalities. We're type A personalities. We're trained in medical school, we're trained in nursing school to be superhuman, right? We're supposed to be able to go without for the benefit of others. And how many people, okay, I'm gonna do a quick show of hands. You're having a really bad day, and how many people, when you're asked, how are you feeling, how many people just say, I'm doing okay, no matter how you really feel? Just, you're okay, right? And really, on the inside, you're feeling terrible. We're always putting our hands up, but we're doing fine. Nobody, and so that's the way it always is in healthcare. We're always okay. And if we don't take care of ourselves, how can we take care of others? We can't. And we have to be kind and compassionate to ourselves first. And we need to really let go of judging ourselves all the time and judging others, right? One of the things is, as physicians, that we're always trying to make judgments. Judging, one way or the other. Good, bad. Things sometimes are the way they are, and unfortunately, despite our best efforts, and what people may believe, as we all know, we don't have complete control over our situations, right? That's not, last time I checked, I didn't get a crystal ball that's still working every day to know exactly when everything's going to happen. We don't have that crystal ball. We'd like to, or actually I probably wouldn't. I wouldn't want to know when everything is going to happen. And this is a physician, this is a cardiologist, and his book is great. Is it really worth dying for? How to make stress work for you, not against you. So this is a great story. So this is about 1980. He was a cardiologist. He had taken over, I think, at Nebraska Medical Center. And he was really trying to create his own name. He was in his early 40s. And he had an angry encounter the morning before he was to give a talk at a small hospital. So at that small hospital, he really didn't feel well. He started to feel kind of queasy, and then all of a sudden really started to develop chest pain, thought it was indigestion, thought it was the cold cuts, I believe, that he had. And so he checked himself into the coronary care unit at the hospital that he was giving the talk to. and he was having a heart attack. And this is his quote: I had brought on my own heart attack. I knew, because when I asked myself if I could have avoided it, the answer was yes. I really believe I could have. The way I reacted emotionally to work stress had made me vulnerable. That's a cardiologist. So we got to come up with a better way to approach where we're at. And how do we need burnout antidotes. So this is a picture of me for the ALS challenge, so that's me putting out the fire. But we got to figure out ways, and again, some of what this talk evolves from is some of the conversations that I've had with physicians that are doing the kind of work to try to improve physician burnout. And I put a picture of that book down the bottom. Dr. Drummond actually has a whole company based on working with physician burnout. And some of these thoughts are from his book, but also conversations that him and I have had over the last couple of weeks as I'm kind of prepared for giving this talk. But we've got to have strategies to become more efficient and improve workflow. Okay, just because we have a computer system that continues to get bigger and bigger and bigger and everybody wants more information into it, doesn't necessarily mean that we're providing better quality care, right? It means we're adding more data. I mean, how many times in a day when we look at the data, we look back at the data and we go, does that make sense? Does that blood pressure make sense? Does that weight make sense? It doesn't, right? So if we just put more data in that doesn't have meaning, that's what we have to decide. We have to decide in our EHRs what's meaningful. What do we have to put in there? What's going to make a difference, right? Isn't our number one goal to take care of patients? Isn't that our ultimate outcome? It's like how well we do to take care of patients, not how well we deal with our computer. Now, sometimes I try to make a joke. I say, well, I think the patient is currently our computer. We should probably just, we roll it around, put a name on it, maybe that's our patient. Because unfortunately, sometimes that's the only patient that's rolling around right now, is the one that's going down the hallway, is the computer. We have to get back to the bedside. We have to get back to who we are. We have to take better care of ourselves. If we're not in balance, we can't do it for other people. There's no way. If you don't practice what you preach, it's not going to work. It just doesn't work. We have to balance and recharge. And we have to be aware. The catchphrase mindfulness is being where you are. And we're not most of the time. I can tell you that up until the point that I started to work on the internal work for myself, I would sit at the dinner table. How many people have sat at the dinner table? Okay? And you're sitting there with your family and you're running the entire day back and they're talking and you're just going through the motions. How many people have been there where you're not there? I don't know where I'm just like, I'm back at work. I've got 5 patients running through my head and I'm not with my family. And you do that for a long time, guess who you burn out? Your family, right? And your friends. And you burn out the people that really make a difference to you because they've started to tune out, right? And there's no I in team. One of the things that we all think we are, we can do more than what we really can do. And we have a hard time in medicine, especially as physicians, asking for help or looking for help, right? So we always think we can do everything. We're better than the other guy. We're smarter. We know everything. That's the way we were trained. I scored really high on my MCAT. I scored really high on this test. Like that is supposed to be, it isn't, right? We know. We've all done this, right? The test score doesn't mean anything. It means the ultimate test is taking care of patients. It doesn't matter whatever board or how many boards you've taken. That's not the ultimate test. It's how you take care of each individual patient. And we've got to advocate for change, right? So one of the reasons I did this talk was to try to get the ball rolling so people realize that we have to have ways, mechanisms, at least start the discussion about having opportunities to de-stress. And whether it's through meditation or yoga or exercise, or just having groups that can get together and talk about what's bothering them, that's really important because being together and being connected, in Rosetto, that actually was great because, being connected, you didn't have a heart attack despite, how much lasagna you ate. That's fantastic. Much lasagna as you want, you're fine. Smoke your cigar, you still won't get a heart attack. That's a pretty good deal. So we have to realize that being connected is a really important thing. And we've got to rebuild the doctor-patient, nurse-patient relationships at the bedside. And one of the things I like to talk about is time and touch. Okay, if you want to help patients, you have to spend time. And you have to be able to touch their lives, right? That's what we need to do. You can't do that. And one of the things I see in healthcare now is that because we become so computerized and we become connected yet disconnected. I've said that to people before. We can take this thing here, and we can connect ourselves to the world electronically. Yeah, but we can't talk to the person that's across us. We can't talk to our neighbor. We can't talk to our patient. We have an algorithm for everything. We have an algorithm for algorithm at this point. And there's algorithms for that too. Don't worry. Someone's coming up with it because that's what we need to do. But you can't have an algorithm for human touch and for taking care of people. This is an art based on science, and it really starts with us being able to do it ourselves. And we have to be allowed to be human. We are human. We don't like to accept that, but that's exactly what we are. Okay? Sometimes, one of the things that has got us into trouble, though, is we become, as physicians or healthcare providers, detached from that kind of emotional experience, right? We have that, we're not really there. We separate ourselves. We put a big barrier up, right? But I think that one of the things that people are learning in medical schools are starting to learn that actually being able to connect and be able to relate to different emotional things is really very important for us. And we're not doing that. That's not how we were trained. That's not how I was trained, actually. And I'm not that far out of training. So when they talk about the Flexner report, maybe we really do have to revisit how we train medical students. Maybe that's the root cause. Maybe that's how we have to change healthcare, is to go back and give people a different way to look at this. I would say that the PTSD that we suffer in medical care is something we don't talk about when things go wrong, right? We don't talk about that. We're just kind of like, the debriefings that go on doesn't really cut it. We're often, again, become very self-critical. And there's many different problems that lead to something that could go wrong. But at Cleveland Clinic now, it's, something bad happens, they have a whole team that, that goes out and tries to respond to when people are suffering, when something happens. To the healthcare providers to provide support. It happens. It happens to everybody. And we have to be able to think about this because it's really important, and we need to be transparent in a way about things that happen, to have an open discussion about it and try to figure out and learn from those things. Okay, we can't be perfect. We have to accept that. We're not perfect. I'm not perfect. How many people in this room are perfect? Super. Fantastic. That's awesome. We have one perfect person. And this is true. This is why we do what we do. I believe this. Taking care of patients is the key to coping with the stresses of contemporary medicine and identifying what is important to you, what you believe in, and what you will fight for. For me, I've learned it's the human moments, such as the house call with Hyman Gesselman. The human moments are what others, the lawyers, the bankers, envy about our profession. And no company, no agency, no entity can take those away. And I've had the opportunity to personally correspond with Sandeep, and he was really open and said, share whatever you can to try to help others through my book. And I would encourage people to read this book because it really is an eye-opener in terms of a different way to think about how we can change or what we need to change. So we're interconnected. So on the right, that's a telephone order that still stands in PCU right now that I gave to one of the nurses. Is be present in the moment. It's the only moment we have. Let go of the past. Be well and have a peaceful day. Okay? And we're in this together. Right? We're not in this against one another. We're in this together. Okay? That's what we really have to realize. And recognizing that people bring different things to the table and everybody has strengths and weaknesses is really important. Knowing our strengths and weaknesses is equally important. So the Mindful Revolution, this was a cover of Time magazine about 6 months ago. And it's become very trendy. And actually, John Kabat-Zinn's very concerned that he doesn't want to become McMindfulness. That this is actually something that's more than just being a passing fad. And it really has exploded. And now the science behind it, which is still just the tip of the iceberg, these studies are just starting to show what physiologic changes are happening when we practice meditation, we practice yoga, we become connected with one another. And these are only some of the relaxation responses, right? Everybody, there's other things. You know, getting together with friends, going for a walk, you know, a hobby that you may enjoy doing. These are other things to open up the relaxation response. And it doesn't have to be one size fits all. And even within meditation, there's some people that really can't sit still. Maybe they have to do walking meditation. Maybe they have to do something else. Maybe they have to do yoga. But there's all different ways of trying to experience this to kind of bring ourselves back to the present moment where we are, where we need to be. So happiness. This is written, so this guy is apparently the happiest guy in the world. He is. He's the happiest guy in the world. And Matthew Ricard, he is a Buddhist monk who was a cell biologist in France, gave that all up, and he's now a Tibetan monk. And he's actually one of the first people I think they studied in terms of doing some of these brain scans with meditation and functional MRIs with Richie Davidson out he's at Wisconsin, I believe it is. And so we will willingly spend 12 years in school, then go on to college or professional training for several more. We work out at the gym to stay healthy. We spend a lot of time enhancing our comfort, our wealth, and our social status. We put a great deal into all this, yet we do so little to improve the inner condition that determines the very quality of our lives. So think about it, right? We do all this stuff. We exercise, but we really don't do a lot in terms of mind exercises, do we? Right? We don't have a lot of tools in the toolbox. We weren't really taught that as little kids, right? You know, so we have to be able to figure out that there are resources and there are tools to be able to do that. So here's the functional definition by, you know, again, John Kabat-Zinn, who is regarded as one of the leaders in mindfulness. Mindfulness means paying attention in a particular way, on purpose, in the present moment, non-judgmentally. You're there, it is what it is. You're aware. And everybody goes, oh yeah, I'm there. I'm always there, right? And then you start to think about it and you go, you know, maybe check in on yourself each day and drop in on yourself and realize, where am I? Take a day, take any day, and just drop in on yourself and try to figure out where you are at each moment. You know, are you in with a patient? Are you thinking about the next 3 patients? Are you thinking about the last 3 that you saw? What you have to do tomorrow? What you have to do tonight? Where are you? Are you able to leave those things where they are and be where you are? And accept no matter what. So non-judgmentally means that whatever the situation is, it may be uncomfortable. It may be a good one. It may be that patient that's in your face and is just angry about whatever it might be. Or they're thanking you. And you don't want to grasp either one of those things too much. You have to accept them for what they are, right? Because we push away those things we don't like. But those things teach us something about ourselves, don't they, right? When there's a difficult situation, you learn something. Just as something that good happens. But neither one of those things stay that long. And one of the ideas of grasping either one of those, they don't last forever. But being able to bring yourself back, you know, something bad, so one patient, something bad happens, the next one, something good happens, and just be there. Don't be lost in the last thing that happened. So this is my strong recommendation. So again, this isn't a warning, this is a recommendation. Most packages, right, come with a warning, right? Warning, don't smoke cigarettes, right? So my recommendation is take the time to read the full Catastrophe Living with particular attention to chapters on time and time stress and work stress with the hints and suggestions for reducing work stress. If that's the place that you start, that's great. This is a tough book. You know, the book is now 650 pages long. It was about 400, but because there's more data in the last 25 years since the book was published, guess what? It got longer because now it includes everything. So the data is there, okay? But one of the things I do with patients is I tell them, go get the old one. It's good enough. You get what you need, and it's a shorter read. You can get it for about a penny on Amazon, and if you get the CDs that go with it, you can get your whole mindfulness-based stress reduction program for about $10, and it's a lot better than pills. So John I sent a message to John, and John let me share his stress reaction cycle. So again, this is again what happens in the body, and a lot of this was touched upon in terms of the movie. We have either an internal or an external stressor. It sets off the fight or flight response. Okay, and you have that immediate adrenaline surge, cortisol release. But the problem is that many of us are under chronic stress. It's not just, sometimes stress is a good thing, right? We keep saying, well, stress is so good. Stress is good. Certain things you need to get done. If you really did have a lion, you better be able to get out of the way. You're not going to be able to meditate that lion that's coming at you away. Then, okay. But the chronic stress causes all these maladaptive things that occur in the body. High blood pressure, anxiety, palpitations, inflammation. And then how do we cope with those things, right? We cope with them, the positive way is to go for a walk or do something that's going to help you, but oftentimes we deal with them maladaptively, and that's where we talk about addictions, whether it's overworking, whether it's depending on substance abuse or alcohol or cigarettes or caffeine or food, right? We all find different ways of some kind of dependency, and then it causes the body to break down. Because things are out of balance, right? The wear and tear in the body, and that leads to depression. It leads to burnout. And for people that are predisposed to certain things like cancer or heart disease or infections or inflammation, they get sick. I mean, how many of us, okay, I mean, we've all done the experiment. I can't publish it, but if we raise hands now, I'll publish it afterwards. We'll call it the study. How many people, when you get run down, get a cold or get sick? So we know, right? We already know that happens. And I can tell you that to the extreme cases in cardiology, there's an entity known as stress cardiomyopathy, or Takotsubo, or whatever way you want to call it, but patient has a stressful event, a death in the family, and the heart function, it looks like a heart attack. Every patient comes into the emergency room, everybody thinks they have a heart attack. They do a catheterization, the arteries are open, and the heart function is 50% of normal. It's real. The bottom of the heart balloons out, and usually within the weeks afterwards it gets better. So if that's like the extreme case of mind-body influence, right? You can basically look and feel like you're having a heart attack, short of breath, chest pain, the whole thing. And the heart function, it's not just you feel that way, right? I mean, some people have panic attacks, we get that, and there's no real effect on the heart. But we're talking heart function by 50%. The whole bottom of the heart balloons out. That's pretty impressive. So how do we change the paradigm? How does mindfulness make sense here? The mindfulness end of things, again, being present in the, paying attention to the present moment on purpose. Okay, but what does that do to us? Well, it changes our reaction to responding. That's the whole thing. The whole thing comes to reaction versus responding. It's the difference between the reflex hammer hitting the knee and coming out, or willfully moving your leg. Okay? So basically, the mindfulness response doesn't mean that your situation goes away. It's not as if all of a sudden everything just floats away. If I still have somebody that's sick in front of me, I have to be able to act upon that, right? But when people panic, your mind gets hijacked and you can't be present, right? So the idea behind the mindfulness-mediated stress response is being aware, being present, knowing where you are, knowing the whole situation and what's going on, rather than being overwhelmed. You're going to have, not only that, is you'll be able to respond quicker to whatever that, or recover from whatever that stressor may have been. So if the one thing that you remember is that what mindfulness can really bring to the table is the difference between reacting to things in life and learning to respond, that second, that ability to slow it down enough is everything. It really is everything when you're making decisions. But, again, don't forget, we all need a little humor to this. So one of the things is my good friend Loretta, who did her talk for us last fall, is that, we don't have to take ourselves so seriously about all these things too. And that's one of the things that's really important. You know, we talk about a lot of these things, and you know, you have to be able to do meditation. You have to be able to take yourself not so seriously at the same time. So it's okay to be present and laugh a little bit. Have a little bit of humor to what we do, right? You know, I brought my red nose for this slide, right? So in the office yesterday, you know, I had the red nose on, and I got challenged to go into a patient's room to do the whole encounter with the nose on, and it worked out perfectly, right? The patient the first thing was she smiled, so that turned on her relaxation response. It caused the rest of the staff to giggle a little bit. It didn't decrease my credibility, okay? I promise. But we have to be able to take ourselves a little less seriously, and that's being mindful as well. So, okay, in order for it to be a medical talk, I'm going to go very quickly, because the whole point of this was to give some people some tools in the toolbox, not just to sit here and blab about all this stuff. But I have to give you the data, right? So where things stand. So this Journal of American Medical Association article from about a year ago, 47 studies dealing with meditation demonstrated evidence to suggest improvements in anxiety, depression, and pain. 45 physicians that demonstrated, now this isn't a study of a do or don't do, but 45 physicians that scored really high on a score or a measure of mindfulness. The patients felt that they were more engaged in the patient-centered communication and had more satisfied patients. That's got to be good for all of us. 36 nurses in a telephonic MBSR 8-week course showed improvements in health, stress, work burnout, with increases in serenity, empathy, and self-compassion. If you can empathize with the patients, that's part of what we do as healers. And I think that that's, again, more evidence within the last couple of years. These are two studies, one from JAMA and one from the Journal of Psychiatric Medicine. 70 primary care doctors in an 8-week program, this was up in Rochester, New York, showed a decrease in burnout and improved empathy and mood. This was a combination, 93 healthcare workers, but it was actually doctors, nurses, I think it was residents. There were different levels of training, and all showed that burnout scores improved, as did mental well-being. And this one just came out, perfect timing. I want to thank Jonathan Felix for sharing this, because I had not seen this, and this is how this slide made it in. But there was a recent study that showed SICU nurses that participated in a randomized study of an 8-week MBSR showed a 40% decrease in salivary alpha amylase, which is a marker for stress and sympathetic activation. So we're talking about our SICU nurses, right? Pretty stressful. And I think that I unfortunately was not able to get to the whole article, only the abstract at this point, because it was late last night. But this is more evidence to support that it's not just a woohoo kind of good idea. This really makes a lot of sense, and it works. And people that start to realize that meditation is really an exercise form, but really exercise for your mind, really start to understand that some of the barriers or the stigmas that people may carry around with them really break down. They go away pretty quickly. And this is a meta-analysis of nurses, physicians, mental health providers, improvement in well-being and burnout. So there's several studies here that are starting to, again, shed light that if we're able to practice what we're doing, not only is it going to help our own well-being, but it's going to help those around us and help the patients. So I love this. This is a quote John has. You can't stop the waves from coming, but you can learn how to surf. And that's true. And that's really the point of learning mind-body practices. It's not like everything goes away. It's not like life goes away and that you sit there, just sitting there all day long, you're participating. But you learn how to be able to get your surfboard, so to speak. Okay? You get your surfboard and you learn how to surf. And that's what's really important. So I think that these techniques are your surfboard. So, all right. So I'm going to do something that, so now it's participation time. We'll do a couple of things. So this one I adapted from Pema Chodron. And it's very simple, and I do this with patients on a daily basis. And it doesn't take that long to teach them how to do this. So what I'm going to do is I'm going to walk you through this. So I want everybody to just put your hand on your belly just to start off with. Okay? I don't want you to pretend that your belly's a balloon. Okay? And I want you to just breathe through your nose and inflate that balloon. Keep breathing through your nose. Okay, good. You're all pros already. It's too easy. So I want everybody to put your hands down in your lap. And I'm going to walk you through this. So the first thing I want you to do is to close your eyes and say the word pause in the back of your mind. And now I want you to breathe from your belly, inflating that balloon again through your nose. And continue to focus your attention on that breath in the belly. Now, continue to do that. And one of the things you're going to find is that your mind starts to wander. Just bring your attention back to your belly and continue breathing. And the thoughts that you have, let them pass just as if they were clouds. Keep coming back to that breath. You may hear sounds, let them pass away. Tension you feel in the body, let go of that. Any pain. Let yourself relax into your seat just like you're a wet dish rag. And bring your focus back to your breathing. Going to take 2 more breaths in and out, in, and on the out breath I want you to say the word relax, open your eyes, and move on. How many people did their minds wander? It's hard. Even for people that are trained and do this all the time, your mind is going to wander. So that's actually the truth is that even the Dalai Lama still has to work at it every day. Okay? But the idea is that, you know when you do this, you're flexing your muscle. What we just did then was to bring yourself back to your breath, your anchor, right? When your mind wanders. And that's just one simple technique. Okay. And I don't think today, everybody is not going to want to stay until midnight, so we're going to keep it simple, and I'm going to give you some tools and some resources, but you can do that now in the morning. 3 breaths, 3 minutes, 30 minutes. And then, if you do it routinely, then you can do it for the 3 breaths before you walk into the room for that difficult patient, perhaps. Or before you stop yourself before that habit, right? You take 3 deep breaths before you pick up that cigarette, before you pick up that bottle, before you pick up whatever habit or whatever food may be harming you. And you just breathe. It sounds simple, right? But we don't do it. Because we don't train ourselves to do that. So that's one. So one of the things I like to do is let things pass, thoughts as clouds. If a thought comes through, it's okay. Don't try to block everything out. Just bring yourself back. Things float away, bring it back. An unpleasant thought, it floats away. A good thought floats away. And sometimes you may find that things float the whole time. Don't judge yourself. Now, the problem is that one of the things about mindfulness is judging, right? So if you judge yourself that you're doing a good or bad job at meditating, you're defeating the purpose. The idea actually is that you actually may have done a fantastic meditation if the whole time what you needed to do was to keep bringing it back. Another thought, bring it back. Another thought, bring it back. And then the bell goes off 30 minutes later and you're like, wow, I don't feel like I accomplished anything, but you actually had. You flexed a lot of times to bring yourself back. And it's work. It's actually really not that easy to be able to do that. And you have to be able to do it and sustain yourself to do that. So that's that one. So now I'm going to do one that's funny. So Dr. Drummond gave me the opportunity, again, gave me the heads up and the thumbs up because he's going to trademark this pretty soon, to talk about the squeegee breath. And at first I said, squeegee breath, this is no way. Squeegee breath, really? So he actually published a study. Well, it's not published. It's been sent. It's going to be published in the next couple of months. So squeegee breath, and I would encourage anybody who has the opportunity that really is feeling like they're struggling with burnout to pick up a copy of this book. I think it's $10 or $15. It's really well written, and it actually looks. And the other thing is, he actually was at UMass last week. He goes around the country working with health industries, trying to work with burnout. He was at UMass last week, and he was Cooperstown the week after. So he goes around working with physicians, healthcare workers, nurses, therapists, etc. And the book's great because it has. We need to not just think about mindfulness as a resiliency technique. We need to change our relationships to the way the workflow is. I say workflow and life flow. Those are the things that he has a lot of great advice as to how we can change our relationships to those things. So I want everybody to stand up for this one. Okay? And what we're going to do, the hands down, nice and relaxed. So I want you to breathe as if from your toes to the top of your head, and I'm going to count 2, 3, and then you're going to breathe all the way out. And I'm going to count, and this is the first way we start this. So breathing in, 2, 3, and breathing out. 2, 3. Good. So that's the first start. Now, so where does the squeegee come in? The squeegee comes in is on the out breath. Anything that you don't need there, you squeegee out. Okay. I'm going to do one other thing. The first thing to do is to set your intention to be calm and present. Okay. Then we're going to breathe in. We're going to squeegee out. We're going to finish with a smile and ah. And I will walk you through this a couple of times. Okay. So we're all going to set our intention right now to be calm and present. We're all here, no place else. And thanks for being here, by the way. Breathing in. 2, 3. Squeegee out. 2, 3. Smile. Ah. Everybody do that. So we're going to do that again. The R always feels the best, I think. That's a real release at the end. So we're going to do that again. Breathing in. 2, 3. Squeegee out anything you don't need in. Everything that you don't need out. 2, 3. Smile. Ah. Now the practice, you can use all the hand motions you want. Okay? But in real life, you can do that just quietly without anybody else noticing it. So now we're all going to practice one where nobody needs to know what you're doing. So your eyes open, and I want you to just breathe in. 2, 3. Squeegee out. 2, 3. Smile. And a quiet. So, and it takes a little practice, right? You have to be able to do it because it feels a little awkward at first. It's like, oh, I don't really do this, you know. I think that if you felt comfortable doing this the first time around, I think even the practice meditators may feel like, I'm not so sure yet, right? But once you start to get to use that, and you become comfortable with it, it's a quick mindful breath. And actually, one of the reasons that he had trouble is because the mindfulness gurus basically said, oh, this can't be MBSR, right? It needs to be something else. I don't know what that something else is, but intention to be present and calm, a breath, squeegee out, smile, and it seems to work for me. And the thing is that I will share with you that that's happening around the hospital with some of the nurses now. At the nurses station, is that I have to tell you that I've already started squeegee breaths throughout the hospital for anybody who wants to know. Okay? That, when we're getting, and, think about it. If you do that breath before you walk into that difficult patient's room, it breaks the cycle. It gives you that second, right? So even if you're not even to do that other breathing that I talked about, the first one there, okay, the more classic form of mindful breathing, you could do a squeegee breath. And you remember it because it's funny, right? It's like, but then after you get beyond the humor, you realize it's actually really brilliant because it does exactly what it's supposed to do. And the other thing is, it doesn't take you maybe 8 weeks in order to learn how to do that, right? So you all are now certified squeegee instructors. However, okay, listen, as he made it very clear to me, he said, when you share it with them, they have to do super habits, meaning that like anything else, it has to be part of what you do. So the whole idea of mindfulness, okay, is not just sitting on the cushion and meditating, it's incorporating it into your life so it's sustaining. So what happens is many times that people start out on this path and it feels good for a little while, and 6 months down the road they go, oh, well, I used to like to do that. And then you have to realize you have to sustain this. Okay, so the sustainability here is to tie it into something you do all the time, right? Whether it's starting your car, cup of tea, starting your coffee. So in the morning that you start to do it at different times, so then when you need it, it's there. If you do an, oh my God, I hope it's going to work right now, I can tell you that it will not work, right? So if you're not doing these things consistently, and you go, please, right now, with this patient that's screaming at me right now, you have to be able to do it and realize it's a practice like anything else. You have to be able to do it consistently. Okay? So there's that one. So everybody feel like they're a squeegee expert at this point? Okay. There we go. It's the I'm telling you.
He's the expert.
Oh, we all sat down. We got to stand up again. I'm sorry. So bad. Okay, again, I have to share another secret today, is that for anybody who's followed this on Facebook, these pictures are taken from various locations around the hospital. So this is actually happening as well already. So the technique is that when I get really stressed when I'm on call or wherever I am around the hospital, or actually when I see that other people are also stressed, okay, meditation and motion, even 1 to 5 minutes, even 2 poses I've seen actually change the entire emotional connectivity of the nurse's station dramatically. Right? You're in one of the telemetry units, and guess what's going off? Oh my God, everything's buzzing off. It's just this noise and this energy and this stress, and everybody's like, what's happening here? You can't even think straight. And in the middle of all this, I will simply say, okay, it's time, right? Not, of course, if there's a code or something bad happening, okay? If you do attend to that, we only do mindful yoga as appropriate, okay? And I'm there to monitor the telemetry if there's any problems, I promise, okay? I'm there, okay?
Sure.
And just remember, though, for the people that don't do it, it actually lowers their stress, too. I will tell you that Ed Klein has really laughed at me pretty hard a couple of times when you see me do it, so it's actually decreased his stress. So the onlookers get to laugh out loud. So it is what it is. So we're going to do a couple. Now, I'm under a lot of stress right now. Okay, I'm feeling it because there's several yoga instructors out there, and I'll be getting critiqued in messages later on, so bear with me, okay? Just for a second.
Squeegee that out.
I'm going to squeegee all that out right now, okay? So what I want everybody to do is to reach up straight. Again, I want you to just breathe. So with each pose, make sure that you breathe. Breathing is good. Doing yoga and not breathing, not good. Okay, now, gently bring your arms down. Breaths. The next one we're going to do is we're going to reach for grapes. So what I want you to do is to lift your right heel. You're going to take your right arm and reach down to the ground. And you're going to take your left hand and reach up as far as you can. Unless you have a bad rotator cuff, then don't do that. And stretch. And down. And we're going to switch to the other side. Balance. Reaching up. And relax down. So, now we're going to do a little balancing. So balancing on your left foot, your right foot out. Don't kick your neighbor. If you're a little wobbly, that's okay. Just keep breathing with it. Remember, it's bringing yourself back. Even if you tip over, it's okay. We're not being judgmental. No one will laugh, I promise. You can laugh at me. Okay, and down. And go to the other side. And for anybody that wants to crank your foot around one direction, and then crank in the other. And down we go. And I'm going to give you the best one for lower back right now. So we're going to do the cat and the cow. Okay? So, knees slightly bent. Okay, we all know how a cat arches their back. I want you to reach out. And breathing out, blow your breath all the way out. Stretch your lower back. And now we're going to take a breath in, and I want you to bring your arms behind you so you look like a cow. Arch your back out. And we're going to do that again, stretching all the way out, blowing your breath out. And then back like a cow. So now we're going to do a really simple one. We're just going to crank our neck all the way around. Breathing in and out. In and out. And we're going to switch directions. In. Out. In. And out. Okay. Do shoulder shrugs. So you're going to bring your shoulders up and all the way back. Breathing out and breathing in now. And let's reverse direction. we'll finish with 2 more. So we'll do the tree. So we're all going to be trees right now. So take your left leg up, balancing on your right foot. Starting here, and then up. Whatever you feel comfortable with. And we're going to relax down. Switch sides. Up. And relax down. And you can't finish a little yoga without a warrior pose. So we're all going to go. So take your left foot, okay, pointed in this direction. Take your back foot at a 90-degree angle so your hips are this way. Okay. The one thing you do not want to do when you lean forward, you don't want your knee to go beyond 90 degrees or else you're going to injure your knee. So the back leg is forward. And breathe. Actually, I apologize. What I'd like you to do actually this time is reverse warrior. So stay in that same position. And reaching back with your front arm, reaching down with your back arm. And let's finish here. Okay, we're going to switch. Let's balance this off. Don't forget, I will be getting critiqued by the yoga instructors out there, and the meditation instructors for that matter. I'm in trouble. And reverse warrior. And let's finish here. Have a seat now. A few last comments, and I'll make sure we get everybody home. There are many other mindful practices. Like I said, we'll be here till midnight if we decided to do more. Body scans, walking meditation, loving kindness meditation. And really, the point is that any activity, if you can incorporate mindfulness, is a mindful activity, right? So it's part of who you become and where you are. I'd like to recognize Jonathan Felix, because Jonathan here, my friend Jonathan, is a wonderful meditation instructor, and he was kind enough to share his skills with us and did an 8-week meditation course at Hawthorne for the healthcare providers. And he also has his own website, quietmind.com, which has some great resources, and he's really a wonderful asset to our community. And Jonathan, thank you for coming tonight and being here, and also being, a friend, a mentor, and just an overall a sage for all of us around here. Thank you. And then this is what's possible. So we're opening eyes here, and Jessica Webb, thank you for being here. So Jessica is a meditation and yoga instructor, and she's actually has some information in the back. She's going to be teaching an MBSR course this summer, July and August, and she is instructor for meditation at Cushion Company. So, you know, they're already setting the bar in terms of worksite wellness and in terms of incorporating stress reduction as being something that's really important. And I think that you know, we're in healthcare, we're trying to take care of people. This should be an example for us to start to look at an opportunity for us to do meditation or mind-body medicine here in healthcare institutions. And I just love this. This is great, you know. So this is the Jolly Good Fellow. How many people know about the Jolly Good Fellow? So Google has the Jolly Good Fellow, and he goes around and he is their Jolly Good Fellow. That's all I can say. Is that he runs the meditation program at Google. He's written a great book, which I have read. Imagine whenever you meet anybody, your habitual instinctive first thought is, I wish for this person to be happy. Boy, I tell you, that doesn't become any more powerful than that. I mean, that is like, if that's the simple way you live your life, it doesn't get any better than that. And this is a Washington Post. You want to prevent thousands of deaths a year? Make doctors and nurses meditate. And, you know, this goes on to say, basically, it increased personal well-being, decreased burnout, improved attitude, patient-centered care, decreases medical errors, and there was, for example, likelihood of a surgeon self-reporting a major medical error increased by 11% per 1 point increase in the depersonalization scale. So it's not just a good idea, it's good for our patients if we're in the right place. We all need a sense of peace, and anybody's interested, you can buy Sense of Peace at the Green Bean. So really, this is a great tea at night, and we really have a sense of peace in New Bedford, so in case you're wondering. And Dyke Drummond wanted me to share this. He said, the only thing you need to remember about burnout is that you can't give what you ain't got, meaning that if we don't have it within ourselves, we can't give it to others. And these are all the resources. The Happy MD is Dyke Drummond's site. Yoga Nurse, MBSR can be done online, which is actually where I did my MBSR training. Quiet Mind, Yoga Kids, Anchor Meditation, Sir Linkba Meditation Center. Some of these things are in our own community already. Okay? And also I want to, Jeff Costa, who was kind enough to come today, who is the yoga guru for the area. And he said he will be critiquing me later, so it is what it is. But I want to thank him for coming here today. And, you know, again, there's so many yoga, meditation instructors in our own community. We just need to reach out to them and incorporate them as being important. You know, and I think that if we really start to think about building programs within our own healthcare institutions, the people that we need are already here. We don't have to go anywhere else. So I'm going to finish with a loving kindness meditation. And this is something I took from John Kabat-Zinn and took Thich Nhat Hanh and put it together. And may we be safe, protected, and free from inner and outer harm. May we be happy and contented. May we be healthy and whole. And may we experience the ease of well-being. And may there be peace in every step. And I wish all of you, you know, again, I know all of you could have been somewhere else tonight. And I want to thank all of you for being here. And then I hope that, you know, again, that we plant some seeds this evening that can be watered and grown. You know, all of you really are squeegee breath instructors at this point. You're all certified. I've been certified. You're certified. You're good. You can start to do this. And it's funny at first, but then you start to realize when you see it in real life, when you see it in people's eyes, okay, look in their eyes. You want people to be happy. You want ourselves, and it starts with us. If we're going to be the change, it starts with us. So I want to thank you. If anybody doesn't know about New Bedford Wellness Initiative, there's a Facebook group that's over 1,000 now. I've also got nbewell.com, which has a lot of these resources, so you don't have to jot everything down today. Most of the stuff many of the things I talked about, I put links and resources on the website. And thank you very much. I hope you got something out of this and share this with others. Thank you.
Thank you.